Hello, everyone. It's good to see you all. I'll start by just saying that we have an incredible session planned today called Burnout Basics, Lessons Learned from Developing a Resident Wellness Curriculum to Alleviate Burnout. A very, very important topic in the times that we are living and working in healthcare in Canada. So looking forward to this discussion. Let's move on to the next slide. Before I get into our presentation, just would want to take a moment to acknowledge the land in which I am presenting from. Happens to be the city of Ottawa. And the city of Ottawa is on the traditional unceded and unsurrendered territory of the Algonquin Anishinaabe people. And the Algonquin peoples have lived on this land since time immemorial. And I'd like to acknowledge the historical oppression of lands, of cultures, and the original peoples in what we now know as Canada. And I fervently believe that the work that we do collectively in palliative care can contribute to the healing and decolonizing journey that we all share together. So we're truly grateful to have the opportunity to be present in this territory. Next slide, please. So today's presentation is part of the Palliative Care ECHO Project. And the Palliative Care ECHO Project is a national 5-year initiative that's aimed at cultivating communities of practice and supporting continuing professional development among healthcare providers across this country who care for patients with life-limiting conditions. This project provides a lifelong learning journey for healthcare providers to build local capacity to provide a palliative care approach to patients and their families. The Palliative Care ECHO Project is made possible thanks to a financial contribution from Health Canada, and the content and views expressed throughout today's presentation do not necessarily represent the views of Health Canada. Next slide, please. So it's important to understand that the Palliative Care ECHO Project is not a replacement for foundational training on the palliative care approach through programs such as Pallium's LEAP courses. And if you haven't taken a LEAP course to acquire those skills and knowledge and confidence to provide earlier, more effective, and more compassionate palliative care to your patients and families, such as the one you see here on your screen, LEAP Core, then I would encourage you to do so. And you can visit pallium.ca to get more information. LEAP Core happens to be accredited by the College of Family Physicians for 24 main pro credits for the online version, 28 for the in-class version, and 12 hours with the Royal College. So we have a few disclosures to cover off before we get into the meat and potatoes. So for starters, Pallium Canada is a national nonprofit organization founded in 2000, based here in Ottawa, funded in part by Health Canada. And as I alluded to earlier, we equip healthcare professionals, healthcare organizations, and even communities with the skills and the knowledge to provide palliative care earlier and more effectively and more compassionately to everyone. As I mentioned earlier, the Palliative Care ECHO Project is funded through a contribution agreement from Health Canada, which of course includes these very sessions. We also derive funding from the sale of our LEAP courseware and our Pallium pocketbook, and we are, of course, partially funded through our contribution agreement in other projects as well with Health Canada. So in terms of conflict, I am an employee of Pallium Canada, and I now like to ask each of our panelists to declare any potential conflicts. So I'll just turn that over for them to disclose. So let's open it up, whoever wants to begin.
Why don't we go in order? I'm Daphna Grossman, and I do get paid a small stipend to be a facilitator reviewer for the Ministry of Health Long-Term Care Palliative Care e-learning program.
I'm Kanae Kinoshita, and I work in the spiritual care department at North York General Hospital and the University Health Network, and I have no conflicts to declare.
My name is Rena Arshinoff. I work at Baycrest in the spiritual care department as one of the rabbis and psychotherapists, and I have no potential conflicts to declare.
Hi, my name is Warren Lewin. I'm a palliative care physician at the University Health Network, and I have nothing to declare.
Wonderful. Thank you so much, panelists, for that. So again, welcome. My name is Jeff Moat. I'll be your facilitator for today's session. I'm the Chief Executive Officer of Pallium Canada. And wow, what a power panel we have today. We, in no particular order, as you heard from the declarations of conflicts of interest, we have Dr. Grossman, palliative care physician at North York General Hospital, and wellness lead in palliative care residency and fellowship program, Temerity Faculty of Medicine at the U of T. We have Kanae Kinoshita, spiritual care practitioner, she mentioned, North York General Hospital, University Health Network. Rabbi Rena, we have as well, certified spiritual care practitioner, board certified chaplain, registered psychotherapist, and an adjunct lecturer at Wilfrid Laurier and U of T. And Dr. Warren Lewis, site lead palliative care, Toronto Western Hospital, also part of the University Health Network, and assistant professor, Division of Palliative Care, Department of Family and Community Medicine. Welcome. It's great to have such great minds around the table to talk about such an important subject. So just a few things before we get into it. Your microphones have been muted. Doesn't mean that we don't want to hear from you though. So we do want to hear your thoughts and questions throughout the webinar, and you can express yourself at the very bottom where you see the chat function of Q&A. Please make full use of those. When you do that, you contribute to the overall knowledge that's going to be produced over the next 60 minutes. So thank you in advance for doing so. Please remember not to disclose any personal health information during this session. And lastly, please complete the survey that'll be placed in the chat box at the end of the session. We collect this data, of course, for future reference, all in an effort to improve these sessions as we move forward. And the session is being recorded, and a link to which will be emailed to all of you within the next week. So without further ado, I'm going to hand the floor over to our cherished panelists.
Thanks so much, Jeff, and thanks everyone for joining us today. We're happy to be here, whether we're burnt out or not, to discuss this topic of burnout, which everyone I'm sure can resonate with in some way. Our objectives today are to describe burnout and a model that can be used to design interventions to mitigate it, and to discuss and try out some practical arts-based interventions that can be used to cultivate empathy, strengthen relationships, and mitigate burnout. And all of us joined together over the last couple of years, I think, through a mutual understanding that we are not immune to burnout, and have found a collective sense of resiliency together. And we'll hope to share some of what we've explored over the last couple of years. So just to think about a case as we go through the day, two clinicians on a team are talking over coffee and feeling burnt out. Their patient volumes are high. There's more administrative tasks than ever. COVID's relentless, and they really can't imagine staying in their same job unless something changes. They are frustrated. Their organization's approach to wellness is a gym membership discount, and they're complaining to each other about their frustrations. And they notice that they feel worse afterwards. And they're now wondering about other ways that they can find more meaning in work again. So if you just keep that in the back of your mind as we go through today. So just want you to take maybe 15, 20 seconds to think about, what does burnout feel like for you? And if you can just type in the chat one word, not more than one word, just what does burnout feel like to you? Irritability, disinterest, motivate, unmotivated, tired, exhausted, agitated, exhaustion, depression, feeling overwhelmed, lost, fatigue, exhaustion, giving up, avoidance, impaired cognitive functioning, done, complacency, stress. Thank you so much for everyone who's putting these great adjectives and unfortunate adjectives in the chat. I think we all can relate to that. We feel this on a day-to-day basis, and yet we're tasked with caring for people and delivering high quality care. So thank you for participating there. The definition of burnout is on this slide. It's a psychological syndrome occurring in response to interpersonal stressors in the workplace. It's important to remember that burnout is something that happens with our relationship with work and not anything else. And you put it in the chat, exhaustion. I think when most people think about burnout, they think about being emotionally exhausted. There are three domains to burnout. The first is emotional exhaustion. We just don't have the bandwidth. There's just so much work piled up. Then depersonalization is the second part. So we don't see our patients as people anymore. Instead of Mrs. Smith, who's expecting to become a grandmother next week and just happens to have hypertension, becomes 72-year-old woman in room 1 with hypertensive heart disease. It's easier to just get through the day if you minimize that and don't see people as people. And we ultimately don't feel good about that kind of work. And the third domain is that low personal accomplishment when we're not practicing as we want. In the literature, burnout is measured by the Maslach burnout inventory. It's a 22-item scale. It asks questions like, I feel tired, and you just put a frequency, does that happen every day, sometimes once a month, once a year, et cetera. And it gives a score of each of the domains. And someone is said to be burnt out if they score high on the emotional exhaustion, high on the depersonalization, and low on the personal accomplishment scales. The bad news is that we're all at risk for burnout. I don't think that's a surprise. And what we typically focus on is becoming aware of it, because if we're better aware of what it feels like to become burnt out, then we might be able to mitigate it earlier. And some other general risk factors are listed here. So one thing we wanted to go through quickly is just a theory of how burnout can develop. And on this slide, we have on the wheel 6 areas of work life. And there's a theory, the mismatch theory, which states that the degree of match between a person and their work environment will predict burnout. So the greater the mismatch, the greater the burnout. And these 6 areas of work life, control, workload, reward, community, fairness, values, is what can be measured by an area of work-life scale that's validated, that measures your organizational context of burnout. So the more mismatched you are to each one of these domains, the more burnt out you'll be. So just an example, workload, the amount of work that you have. Some people really thrive and love being run off their feet and super busy, and they want to work in a very busy practice. And if that's what someone values, and if that's exciting for somebody and they're in that busy practice, that may protect them from burnout. But if somebody likes a slower pace and they're put in an environment that's super fast paced, that's a mismatch, and that's likely what's going to contribute to their burnout. Control is the second domain. So just an example there, if control, for the type of work that you have is important to you and you don't get that, then you can be mismatched, and that will place you at higher risk of developing burnout. So, if I value control and I want to be an inpatient clinician, and I'm told by my boss that I have to cover someone's leave and I'm going to be doing community work, home visits, and that's just not something that I'm very excited about, and I don't have control over saying yes or no to that, then that puts me at risk for burnout. And so I think a lot of this seems intuitive, but it's important, we think, when we're feeling a little crispy or we're sensing that something's not going right, it can be helpful if you don't have access to pay for the Maslach burnout inventory or the areas of work-life scale, then something that you can do is just look at this wheel and think about, what do you value? What's important to you of these 6 areas of work life? And is there a mismatch? What are your top 2 priorities? Are you getting what you need within these 2 priorities or not? And if not, then maybe think about how long this is going to last for, what needs to change in order to get you back on track. And I'll pass it over now to Daphna to continue talking about kind of our experiences.
Sure. Thanks, Warren. We learned a lot from our experience in developing this program with the residents and fellows. Next slide, please. The program that we developed had to be and was centered on the competencies that were developed by both the College of Family Physicians of Canada and the Royal College, because the residents and fellows do come from both streams. And really, it was focused on what can we learn about ourselves that we are starting to see the signals for burnout. What are those signals? And also, what are some strategies that we can learn to mitigate them? Next slide, please. So based on everything that we learned, we do have 4 sessions that are 2 hours each that are throughout the year. And one of the sessions, as Warren just showed, is about burnout, learning about burnout, some tools, and the wheel is one of the activities that we do. We also do an improv session, and we're going to show you the activity from that. We do a spiritual care narrative medicine session, and you're going to have some of those activities, and as well as art and medicine. On the right, what we also introduced, and this was because of COVID and we were no longer together, these check-ins, and we kind of peppered the year about 1 a month wherever we could find time to just bring everybody together. And we're still online, we bring everyone together, and it's really almost like, think about getting together for coffee, just talking, just chatting, just updating. And it's not just, it's informal, it's togetherness, it builds a community of support. And it's so wonderful and so important. And what we have found is that even after graduation, these residents, they stay in contact because that community was built. Next slide, please. So we did a study. The numbers now have doubled in the study, and really the feedback was excellent. And again, the feedback has been consistent. Give us practical tools. We don't want to learn about all the theories. We want practical tools. And next slide, please. That's exactly what we did. We have put together a whole year of workshops of practical tools that we are now going to share with you. So I'm going to turn it over to Rabbi Rena.
I was muted there. Hi, everyone. This is an activity that I brought from having done this for many years in various different contexts. And it's a wonderful short activity, or you can take as long as you need with it. But it is something that allows emotions to come up and for the person to reflect on them. So each person is given a sheet of paper, or I guess you could do it online. Maybe that would be kind of fun, but we've always done it on paper. There's a circle. This is more of an egg shape, but doesn't matter. It's a circle and there's a legend on the bottom. They're asked to bring, when it's online, to bring their own colored markers or colored pencils, but markers are best. And we ask them, various different subject lines go across the top. So we have done my feelings about grieving my patients who die. Other times we have used my feelings about working with patients who I know will die. And you can change the subject title. And then everyone is given some time to fill in that circle. There's a legend on the bottom. One column says color, so they'll put in, say they choose red. And the next column says emotion. So what does red symbolize? At the end of the activity, they will have a column, a set of 2 columns that match the colors that they have used. And then we ask people to fill in the entire circle. So it's a big open space. It allows for them to be creative and to think in their own mind what it's like. What's it like to grieve my patients who die? What is it like to work with patients on a palliative unit in a busy hospital? What is it like to grieve my patients? And so we give people time to do this, and then we ask for opportunities for people to share if they so choose. Next slide, please. And here are just 3 examples. We have had remarkable, beautiful wheels that have been created, these grief wheels. So, we'll ask whoever is holding up their wheel, tell us about what you've drawn. Why did you choose certain colors? What does the design represents? Like in the black one, we would ask, you have a lot of black in there. What does the black symbolize, and why so much of it? Were you thinking of a particular patient when you made this, or a family member of that patient? And does anyone else have any similar experiences or thoughts? And then perhaps someone else will say, oh, I thought of that too, and this is mine, and they'll show theirs. So very individualized, very expressive, and people really, they tell us that they get very engrossed in it, and they can really allow those emotions to come up, and then we reflect on them during our discussion. So I believe now we will hear from Kanae.
Thank you. The body scan is another one of the practical activities that we do, and we often end the workshops with either a meditation or a poem. And for those of you who aren't familiar with the body scan, I'm just going to invite you to notice just where your feet are, how they're feeling, and maybe where they're placed. Are they dangling because they're crossed? Are they on the ground? Are your toes pushing in your shoes? Do you feel tingling, or maybe any aching, maybe a heat in your feet? We've just started a type of body scan by doing that. And a body scan is really a form of mindfulness meditation where we focus on the sensations in our body. And when we pay attention to the sensations happening in our body, we start to become more aware. We'll kind of go through a mental scan over different parts of our body and notice the sensations. And this sometimes is helpful because physical sensations are sometimes connected to our emotional states. And when Warren was talking about helping us to become aware, it's another way for us to become aware of what's happening within our emotional bodies, within our physical bodies. And sometimes our physical bodies will give us the clues when we pay attention, because sometimes we don't even realize that we're having stress, or even other emotions that we might be holding in our bodies, and that might be causing physical symptoms like tightness in our chest, or maybe pressure in our heads, or maybe heartburn. So the body scan helps us to bring our attention, and hopefully our full attention in that meditation, to what's happening right now in real time, what's happening in our bodies, which is often really helpful when we're stressed. It's a way of slowing down as well. And with time and practice, the body scan also helps us to learn to hang in, because sometimes we'll have sensations that we don't like, that are uncomfortable, unpleasant. And the invitation is to stay with it and to ride it out. And by staying present in our bodies, even if we don't like what we're experiencing, and we aren't trying to fix or change what we're experiencing, then slowly over time, it increases tolerance to things that we aren't comfortable with. And that's really helpful when we're starting to experience stress in our lives. And it's also helpful when there are things that we don't have control over, which is often what we experience with the patients that we work with. So the goal of the body scan is really to train the mind to be more open and to be more aware of our sensory experience. And ultimately, we become more accepting of what's happening within us. So it's helping us to bring the mind to rest in the present moment so that we can be fully present in our lives and with ourselves, and then with our patients and the families that we work with. You have the next slide, please. The next activity, I happen to be the person who's doing this one as well, is art and medicine. And this was one of the workshops that we did with the residents and fellows. And it was an incredible opportunity to use art to mitigate burnout. And we really looked, by looking at art pieces, whether it was sculpture, whether it was paintings. And in doing this, it really provides an opportunity to hone our observational skills and an opportunity to increase our capacity for reflection, and as well to increase awareness of any kind of personal bias that we might be carrying. Because as we look at art, it's a subjective experience. And so there are no rights or there are no wrongs in it. And it creates that chance, that possibility of seeing how what we see may be very different from what other people experience. And so it says we used a guided museum tour using principles of museum-based education. And we did use the museum-based education, but we didn't always have a physical, we didn't have a physical museum or art gallery to go to. Next slide, please. We had somebody from the Art Gallery of Ontario who was well-versed in museum-based education to help us walk through. And having said that, you don't have to be an art expert to do this. I think this is really, really important. And for the 3 years that I've been involved, I've only ever done it online, and it's worked really, really well. If you don't have an art gallery or museum to source pictures from, you can look at pictures in the room that you're in. You can look out the window. It's really about using these as objects of meditation or objects of focus to reflect on. Next slide, please. So what we do is we usually have a piece of art like the one that we have on the right here, this one by David Blackwood, a Newfoundland artist. And we would invite people to look at it. And you can see we say, take 60 seconds. Sounds like a long time. And in fact, for the average person, they look at a piece of art about 3 to 10 seconds before moving on. So this opportunity to really look at a piece and to keep looking at it, and then to go back to the group and just invite them to share what they're seeing. And usually we can spend 15 to 20 minutes on one piece of art. I think really as a facilitator, and again, just want to reiterate, you don't have to be an art expert. I think really what it is about is creating a safe space where people feel free to bring forward their subjective perspectives and what they are seeing, and for others to have the opportunity to hear it. Next slide, please. So when we ask questions, and this is part why you don't have to be an art expert, is after having looked at the piece of art, then we'll start to ask open-ended questions, very general open questions. As you can see, what is going on in this picture for you? And what is it about what you're seeing that prompts you to say this? Is there something, a story perhaps that you're starting to see in this piece of art? And we kind of keep going iterative rounds of going over and asking, and what more do you see? Is there anything else you see? And then you can just click the next, thank you. And then what we try and do is always bring it out into the group. If anybody else saw something similar, what is the response that they have from hearing that? Did they notice anything different? And these are the kinds of prompts that start to help people to see that what seems so obvious to one person is totally maybe not the forefront of what somebody else is seeing when they look at a piece of art. So next slide, please. We can also ask a little bit more, a few more directed questions and be very focused and saying, well, did anybody notice? And maybe this is the men that are sitting at the end of the tail of the whale. Or you can be thinking of statements for people to say, when I see this, I'm thinking of that. Like when I see that whale stuck under the water, I feel a lot of tension of being held under. So it's these kinds of prompts that are a little bit more directive than the more open-ended ones. Also, really looking at the actual art piece and inviting the participants to look at the color, noticing that it's a fairly monochromatic piece of art, and what does that bring for them? What does that say for them? So these are some of the kinds of prompts and the way that we facilitate. And we always come back together to speak about it as a group and to reflect on differences, similarities, what people are taking away, and that invitation. And then next slide, please. We always try to link it back to the clinical work that we do and what it was like and what was meaningful for them and how does it translate back into the clinical work. I think I have some time, so I would really love to do this with you and just invite you to have a look, and we can do some in the chat, and then we can come back to this slide again. So here's a piece of work. It's a painting by William Kerlach, and it's called Reminiscent of Youth. And I just want to invite you to take, well, maybe we'll take 30 seconds or so to have a look and just see what you're just noticing in this particular piece of art. Thank you so much. I'm just kind of looking through the chat and seeing what you're seeing as you look at this. There's climbing a mountain, carefree activity, innocence, joy, fun, freedom, liberation, the home in the distance, joy again, release, fun, daydreams, community, friendship, carefree activity, play, togetherness, rest. Makes me think of wet mittens. Relax, nostalgia. So many monochrome room and bright remembrances. So the monochrome room, I'm wondering if anybody else was noticing the room. that surrounds the painting? Anything else that you're noticing? Struggling. Yeah, so now we're starting to see struggle amidst all of the joy and the freedom and, you know, the playfulness and all of that. Struggle. The reminiscing. Yeah. And wondering why the boy isn't outside. And that there's light under the door. So, and now the story that we start to kind of come up with is what's happening with this boy here, and is he dying? And what's with the brown cavity on the right side of the hill? Yeah, and that it's darkened in the room. And so as we start to notice and sit with this, there's so much more that we're beginning to see. Yeah, and there is blue sky. A lot there. Anything else that you're noticing as you look? Are you maybe noticing the people in the front, or what's happening to that small group of people on the bottom of the hill? Records on the nightstand. Hope in the face of depression. Pureness of the snow. Yeah, that cavity is unusual. Any thoughts on that cavity over there? Definitely. Potential for an accident. So maybe this is a dream. Potential. Yes, this light under the door. Or is it a wish? Yeah. A reminiscence? Thank you all. Is the big snowball to fill in the brown cavity, right? Yeah. Maybe. So all of your different thoughts on it and how we started. And the first thing we look at was the lightness and the brightness and the playfulness and the pureness of the snow and the children playing. And as we started to look, we started to see so much more, which is often what happens when we are with people. We might get a first sense of what they're speaking of what they're struggling with. But as we sit with them, it's almost like the layers of the onion skin that we start to unpeel and to see and to hear. And I thank you all so much for what you've put in the chat, because I think it also reflects what people are more inclined to see versus other people. But the collective of hearing everybody gives us an incredible holistic picture, and just a whole nother way of looking at a piece of art, perhaps a conversation, a meeting, an encounter with one other person, that there are so many ways, and they're all subjective ways of experiencing one particular thing. And to be able to be aware of that and to hold that, I think is something that we're hoping to do, to just notice that we may be biased in one way and come in with a particular perspective, but as we hear others, we get more and we grow more in understanding and awareness. It's a wonderful activity, and we really love this activity, and the residents really love it. And again, we're doing this online. And I'm going to pass it over now to Daphna to do the next activity. Thank you.
So just like Kanae showed you the activity with respect to art, to this can also be done with literature. You could share your thoughts on a poem, for an example. And some of us enjoy writing ourselves. So as Rena showed the activity of the wheel, some of us would like, it's helpful to depict your own feelings in your own artwork or in the feeling wheel, or perhaps in your own narrative stories. And share that with colleagues. So we're going to do another activity called writing with your non-dominant hand. And if you have a pen or any kind of writing utensil and a piece of paper, I just wanted you to take a minute just to write your name and your full mailing address with your non-dominant hand. And then once you've done that, if you can type into the chat just 1 or 2 adjectives that describes how that felt. Or perhaps you might want to type into the chat a few thoughts about how that might relate to your daily work. Yeah, thank you. Uncomfortable. I'm going to read them out as they come up. Slowed down and made me more mindful, slow and clumsy, messy, frustrating. These are all wonderful, awkward, slow. It took concentration. It was annoying. Any thoughts on how, or what kind of thoughts you have on how does this reflect or relate to the work? Palliative care, the work you do, taking care of our patients. It's hard to accept non-perfection. Isn't that true for healthcare providers? Lots of concentration and thinking. So exactly, something sort of an easy thing that you can just sit and do. It kind of sometimes just gets you thinking, like, you need to accept change, what it means about having loss of control. Help me see how learning a new task in a different way kind of brings you to that awareness of just that concept of learning something new, doing something in a different way. Reminds you when your hand was broken. So this is sometimes a task that just helps you kind of stop and slow down, helps me be more realistic. Being childlike and vulnerable. These are all wonderful, wonderful ideas and thoughts that, really brings out how such a kind of what a simple task really makes you stop and reflect. Wonderful. Thank you for sharing. Let's go to the next slide. And the next slide. And then here's another one we did, again, when we did our improv session, but again, you don't need an improv professional to help us with this. So here's what we're going to do. And if you're sitting with other people right now, you could try this together. If you're by yourself, you could just try this out loud on your own. But imagine you're a time traveler and you're going back in time and you're now going back to the early 1800s, and someone stops you and says, hey, you're holding this, which is a cell phone. What in the world is that? And try to explain or describe to this person from the 1800s what a cell phone is. So I'm just going to give you a few, like 30 seconds just to try that out. And if you can maybe put in our chat, what's that like for you, trying to figure out how to describe a cell phone in words that a person from the 1800s would understand. Or an object. An instant means of communication. Can you imagine what someone in the 1800s might think of that? Being comfortable in the uncomfortable in our work motto for the last year. Thank you. I'm wondering if that relates to the writing or even in trying to describe what a cell phone is. Device to get connected, a way of talking to people far away. Can you imagine what that might sound like to someone in the 1800s? Yeah, exactly. So I thank you for including that. Have to think about how the other person might interpret my language, have to explain more and more, as the words I would use would probably be unknown. Better than letter writing. Instant access, can you imagine, to every book ever written? But really, it kind of gets you thinking of when we try to explain illness and how we might think in medical terms and how we have to adjust our words. A tiny encyclopedia. Yeah. So it's kind of an interesting, it's a really fun thing to do. So it's fun to give that a try with other people, and you come up with other things you have to describe. Thank you. Do you want to go to the next slide, please? So what are lessons that we learned and how do you adapt it in your... Yeah.
Sorry to interrupt. I have to step away urgently for a second. So, oh, I see. They're going to move the slides forward for you.
Okay,
Wait.
perfect. Thank you. So really it's about finding, I want to say this, finding people who are like-minded. Not everybody enjoys this, but there are many people out there, many colleagues who really find value and enjoyment in doing this together. It's like being part of a book club. It's being part of a group. And as we said, you don't have to be a trained facilitator. You have to do what you do every day at work. You have to be like just curious. You have to wonder. You give time for people to share their thoughts, paraphrase comments to make sure they're heard and understood. And just keep redirecting back to your group. You know, that was an interesting thought. What do you think? Really about trying to bring out an illicit conversation. And I bring it back to book club because if you're a part of book club, you know, whoever hosts the book club becomes the facilitator of that discussion. You don't have to be an English major in order to be a facilitator, and you don't have to be an art maven. No, it's the secret sauce. This is like the secret ingredient. Is be the facilitator. Just be curious. Next slide, please. And the beautiful thing about building a community, and I think ECHO has really, is really illuminating, Pallium and ECHO really kind of illuminates how we bring a big community together from all across the country. So your community of practice does not have to be the people who work directly with you or the people who live in the same town or city. I mean, we can build this community of practice across the city, across the province and territories, and even across the country. Zoom, though it can be frustrating, can also bring us all together into one space, even though we are distances apart. It also allows us to share art, share pieces that we've written, share poetry that we want to bring together. You don't have to be able to get to the Art Gallery of Ontario in order to do this work together. Next slide, please. So our case resolution, our two like-minded colleagues decide to set up a time to meet. They initially meet to do the grief wheel together and to talk through it and to share what that experience was like and what they were trying to portray in the grief wheel. And then they end the session with a 3-minute body scan that you can actually download on YouTube. And this allowed them to say, hey, we have a connection and this is a wonderful way to share. And so they decide to meet again. And one of them again brings a piece of artwork, even on their phone, that they really wanted to look at and discuss, and what kind of feelings it brought out and what kind of feelings it brought out with respect to the work that they do. And they had a wonderful discussion, and then they decided that they were going to meet once a month. And each time another colleague was going to bring kind of the center of the focal point or the activity that was going to bring out and elicit that more robust discussion. Next slide, please. So summary, this is a very accessible, low cost arts-based activity that can be incorporated into your resiliency practice. And we're all here together, and we're all in this together. And really it's about finding a partner or other people that you can build this community of practice together. So thank you all. Next slide, please. And I think these are all our references, and this would be a wonderful opportunity. We have time for questions and discussions. And Josephine, like ketchup or even better, unless ketchup is your favorite. So I don't know if you want to type it in. You can type it in, or if you'd like, if you want to raise your hand, and you can be unmuted to ask your question, whatever you prefer.
I think just while we're potentially waiting for a comment, and I'm sorry I had to step away for a moment. Sometimes this is, at least with our residents and fellows, and certainly just going back to the grief wheel that Rena talked about, sometimes this is the only time in someoe's training or career that they've had a moment to stop and think about grieving a patient and what death is like from an emotional lens as a clinician, and tying it back to resiliency. The residents, and I think all of us, have just found like a deep appreciation for just a collective sense of just being, that everyone is struggling, everyone has these feelings. And so one of the takeaways would be, and I'm sure you talked about this, Daphna, so I apologize, but just to echo again how these activities just really bring people together and give a space to unpack and build community.
And I might add that sometimes people are surprised that what they see or how they feel, and I'm speaking about the grief wheel, surprises them that other people have similar feelings, or somebody mentioned something that someone else had not thought of, and that person says, oh yeah. Oh yeah, so it does allow for a lot of self-reflection as well as reflecting on what other people bring in their grief wheels. And some of the wheels are very beautiful.
It reminds me of the idea of shared humanity, and how when we normalize what we're feeling and the stressors that we've gone through, for instance, like when we all have been going through the pandemic, how it sometimes the isolation makes the stressors of burnout even more challenging. So yeah, sharing that, Rena, what you were saying.
Karen, thanks for the comment. Body scan was very interesting. Realization, how one's body can be affected without realizing it. Absolutely. I mean, I think back to when the pandemic first started and that emotional exhaustion and busyness that I had never felt. And when I discovered just a 2-minute YouTube body scan, it became kind of a go-to resiliency practice for me, because in the middle of the day when you're so, I started to realize muscle clenching, and when that would be happening, I would try and step away and just have a reset. And it just took 2 minutes that I could gift myself with, and it was something physical that helped change. So absolutely, thanks for sharing that.
I just wanted to address that question about how do you speak to our colleagues who might be wanting to vent and grumble and complain. And I have to be honest, I've noticed that when I vent and grumble and complain, it is me getting to my threshold of being exhausted, needing to stop, needing some self-nourishment. And it makes me wonder if, you know, if that grumbling, complaining is that they're hitting their brick wall. And so that's what sometimes like members of our team here, you know, who have spoken about this openly is really just wondering like, hey, are you, you know, this all sounds really frustrating. Are you getting close to your brick wall, you know, because often those are one of those signs of just either being burnt out or heading towards burnout. So it's that curious and that wonder and from a place of approach of caring.
I think this is the beauty of doing it in a group, because other people may be venting and grumbling as well. And so there's that sense of they're not alone, and you know, and they'll also hear other people who have a different perspective. And I think sometimes having a whole array of different responses to what people are going through are helpful.
And a whole array of different activities and different questions that we raise. And sometimes in the check-in sessions that we do, emotions do come up. And I think what helps people is that often their colleagues will say, you know, I have felt that also, and they'll talk about their experience. So there's a lot of sharing that happens with these groups.
There's a hand up I see. I'm not sure if it's a question. Norma? Not sure if we're able to get the question. If you want to type it in or unmic, let us know.
I think there was a question very early in our discussion about, and I was trying to find it, but it had to do about being busy, enjoying a busy practice. And then I'm trying to find the original question. It was put to to the panelists, and I just can't find it. And I'm hoping the person who posted the question will copy and post it again. I just cannot seem to find it to address it because it was addressed early on.
I think the original one was, is it reasonable to enjoy high workloads when there is also an emerging awareness of biases affecting care? Can bias be tempered in times of high workload and busyness? I don't know if people have thoughts on that.
I think, you know, some of the activities that we've introduced here, I think many of them are to help us become aware that we may have a bias, and then to look at some of the things that the wheel that Warren presented, and to see how the fit is for us. You know, maybe being inpatient and that kind of workload is not the right fit for us, and maybe being in an ambulatory setting might be. And so I think from my perspective, it's always, I like to have that awareness so I can make a choice. If I don't have the awareness, then I can't make a different choice. I'm just immersed in it. I don't know if that makes sense.
I think there's so many important discussions, and I'm looking at the time and it's 1 o'clock and our prompts from our ECHO colleagues. So there is so much work here to be done, and my hope for all of you is that you're able to kind of take this energy and reach out to like-minded people to build a community of practice. And thank you all.
Thank you so much.
Thank you.
Thank you, everyone. There's been a link added to the chat. Please fill it out. Let us know what you thought of the session. We love to hear from you so that we can iterate and provide you with the right resources and tools to be able to manage. Thank you so much for attending our session.